Hello, I'm Dr. Sundari, Mase, Sonoma County's Public Health Officer. I'm here to share the latest on coronavirus in Sonoma County. So as of April 15th, we have 160 confirmed cases. That's an additional 8 cases since yesterday. 88 are active and 70 have recovered, and we still have the 2 deaths that we reported previously. We have now performed 3,865 tests. So first, I want to let you know that because of the enhanced surveillance program, we found a second positive case with an employee of a care facility. Care facilities include facilities like skilled nursing facilities, residential care homes for the elderly, and board and care homes. The employees were asymptomatic, and we performed a fairly extensive contact investigation to determine if there was any spread. So far, we have not found any spread. We've touched on our enhanced surveillance for congregate living environments, and we'll cover it more in detail in future videos. So today, I really want to talk about the shelter-in-place order because I know there's been a lot of questions from the community about the order. Many of you have asked when it can be lifted, and as you know, Governor Gavin Newsom yesterday gave a press conference on this and provided a roadmap as to when we could consider loosening up our shelter-in-place orders. So first of all, I really want to thank everybody for complying with the shelter-in-place order because it has been extremely effective in flattening our curve and decreasing the number of cases that we've seen here in Sonoma County, and likely has saved lives as a result. So we intend right now to continue the shelter-in-place order, and this is what we're going to look at over the course of the next few weeks. We received some information from the governor yesterday, and I want to summarize what the governor released. He had 6 critical indicators that I support regarding when the shelter-in-place order can be modified. So if you take a look at these 6 factors, the first indicator is the ability for us to monitor and protect our communities through testing and our contact investigation, finding cases, making sure cases are isolated, and finding the contacts of cases and making sure that they're quarantined. And as you know, we're already doing that here in Sonoma County. The second indicator is to have the ability to prevent the infection in people that are most at risk. That is our people over age 60 or 65, and people who are medically compromised. And we're also doing that here in Sonoma County at this time. The third indicator is the ability of the hospital and our healthcare system to handle a surge in cases, as we've discussed before. And we are preparing here in Sonoma County for more hospital cases and a potential surge. The fourth indicator is the ability to develop therapeutics to meet the demand. That we're partnering with our academic institutions and other organizations like the National Institutes for Health to get there. Right now, we're still in the process of finding a vaccine and potential treatments. The fifth indicator is to allow ability for businesses, schools, and childcare facilities to support physical and social distancing. What we've been calling social distancing is to stay 6 feet away from other people when you're in an indoor facility or a business. And that we're also working on here in Sonoma County, and we have guidance for that. The sixth indicator is the ability to determine when to reinstitute certain measures, such as the stay-at-home orders, if necessary. So even after we lift the shelter in place, things are going to look different. Restaurants will likely reopen with fewer tables. Face coverings will become very common in any public setting, and new opportunities will likely arise to support our mitigation efforts. So I thank you for listening in today, and we'll keep you updated more on shelter in place as we have updates. Thank you very much.